Most people have no idea how often liver cancer goes unnoticed until it's in the most dangerous stage. The scariest part? Many early symptoms feel completely normal. People think it's just tiredness, indigestion, stress, or a mild stomach problem. But ignoring these small signs is exactly why liver cancer is often diagnosed in advanced stages, when treatment options become limited. Each year, around 42,000 to 43,500 new cases of primary liver cancer are diagnosed in the United States. In this video, we'll look at 13 early warning signs of liver cancer that you should never ignore. These symptoms can appear weeks or even months before the disease becomes serious. Yet most people don't realize what their body is trying to tell them. Just imagine this. If you understand a few key symptoms today, you'll know whether you're likely safe or if it's time to seek medical attention. Stay with me until the end, because by the last symptom, you'll be able to say with confidence, "I'm safe," or "I need to get checked." And yes, the last symptom is something nearly 99% of people ignore, and this single sign is one of the biggest reasons liver cancer is detected so late. Before we start breaking down the 13 symptoms, there's something very important you should know. Many of these signs can also occur in common conditions like acidity, fatty liver, infections, or stress. That's why it's crucial to watch till the end, because I'll also explain which symptoms are extremely serious, and which combination of symptoms means you should see a doctor immediately. Before we begin, tell me in the comments, what's your name, where are you watching from, and which symptom worries you the most? I read every comment, and I'll guide you with the right information. If you find this video helpful, make sure to like and subscribe for more life-saving health awareness videos. Alright, let's get started with the first warning sign of liver cancer. Number 1. Feeling full or bloated after eating even a small meal. This symptom can appear when liver cancer starts interfering with normal digestion and space inside the abdomen. As a tumor grows in the liver, it can press against nearby organs such as the stomach and intestines, reducing the room they need to expand during a meal. Because of this pressure, the stomach sends full signals to the brain much earlier than usual. You may feel satisfied after just a few bites, even though you haven't eaten enough to meet your body's needs. Along with this early fullness, many people experience uncomfortable bloating or a stretched sensation in the upper abdomen. This change often develops gradually. At first, you may simply eat less without thinking much about it. Over time, meals become uncomfortable, and the feeling of heaviness or tightness may last long after eating. What makes this symptom easy to ignore is that it feels digestive in nature. Many people assume it's due to indigestion, stress, eating too fast, or certain foods. But when this fullness keeps happening, especially without changes in diet, it can signal that something inside the abdomen is limiting normal organ movement. Persistent early fullness isn't just about appetite. It often leads to reduced food intake and lower energy levels. When the liver is affected, digestion and nutrient processing can quietly become less efficient, even before pain appears. Feeling full or bloated after small meals doesn't automatically mean liver cancer, but when it becomes frequent, unexplained, or progressive, it's an important sign that deserves medical attention. Recognizing this symptom early can help uncover liver-related problems before they become advanced. Number 2. Swelling of the legs. Swelling in the legs can be an early warning sign of liver cancer, and it happens when the liver is no longer able to manage fluids properly. A healthy liver helps regulate blood flow and produces proteins that keep fluid inside the blood vessels. When a tumor affects liver function, this balance is disturbed. As the liver becomes stressed, pressure builds up in the blood vessels, especially those connected to the lower body. At the same time, protein levels in the blood drop, allowing fluid to leak out into surrounding tissues. This fluid buildup commonly settles in the legs, ankles, and feet because gravity pulls it downward. At first, the swelling may be mild. You might notice tight shoes, sock marks on your ankles, or puffiness around the feet at the end of the day. Many people assume it's caused by long hours of standing, travel, heat, or fatigue. so they ignore it. Over time, the swelling can become more persistent. The legs may feel heavy, stiff, or uncomfortable, and pressing on the skin can leave an indentation that takes time to disappear. In some cases, the swelling doesn't improve even after resting or elevating the legs. Swelling of the legs doesn't always mean liver cancer, but when it appears along with certain symptoms, which we will discuss further in this video, it's a sign that the liver should be checked. Number 3. Itchy skin. Persistent itching can be an early warning sign that the liver is struggling. In liver cancer, this happens when bile, a fluid the liver produces to help digest fats, cannot flow normally. Instead of being released into the digestive system, bile components build up in the bloodstream and irritate nerve endings in the skin. This type of itching feels different from allergies or dry skin. There may be no visible rash, redness, or irritation, yet the urge to scratch can be intense and constant. Many people notice the itching becomes worse at night, making it hard to sleep. The itching often affects large areas of the body. Common spots include the arms, legs, palms of the hands, soles of the feet, or the entire body. Moisturizers and antihistamines usually don't help, which is another clue that the cause is internal rather than skin-related. What makes this symptom easy to dismiss is how unrelated it seems to the liver. People often blame soap, weather, or dehydration. But when itching is persistent, unexplained, and doesn't improve with typical treatments, it can be a sign that waste products are building up in the blood due to impaired liver function. Itchy skin isn't just uncomfortable, it's a signal. It suggests that the liver is no longer clearing substances effectively, and pressure is building inside the body's detox system. While itching alone doesn't confirm liver cancer, chronic, unexplained itching should never be ignored, especially when it appears alongside other liver-related symptoms. Early attention can help prevent further damage and lead to timely diagnosis. Number 4. Dark urine and pale stools. In liver cancer, the normal flow of bile can become disrupted. Bile is a digestive fluid made by the liver that helps remove waste from the body and gives stool its normal brown color. When liver function is impaired or bile ducts become blocked, bile pigments start building up in the bloodstream instead of reaching the intestines. As a result, the kidneys filter these pigments out, causing urine to appear dark yellow, amber, or even tea-colored, despite proper hydration. At the same time, stools may lose their normal color. They can become pale, clay-colored, or gray because little to no bile is reaching the digestive tract. This change is often noticeable and persistent, not something that resolves in a day or two. Many people mistake dark urine for dehydration and pale stools for dietary changes. However, when both appear together, it strongly suggests a problem with bile processing rather than fluid intake or food. These changes are important warning signs because they reflect internal liver dysfunction. They often appear before severe pain or advanced symptoms, making them an early clue that something is wrong. Persistent dark urine and pale stools should never be ignored. When combined with other liver-related symptoms, they signal the need for urgent medical evaluation to identify the underlying cause. Number 5. Jaundice. Jaundice is one of the clearest signs that the liver is under serious stress. It happens when the liver can no longer properly process a substance called bilirubin, which is produced when old red blood cells break down. A healthy liver removes bilirubin from the blood. But when liver cancer interferes with this process, bilirubin starts to build up in the body. As bilirubin levels rise, the skin and the whites of the eyes begin to turn yellow. This color change may start subtly, a slight yellow tint in the eyes or a change in skin tone that's more noticeable in natural light. Over time, the yellowing becomes more obvious and harder to ignore. Jaundice often comes with other noticeable changes. Urine may become darker than usual, stools may appear pale or clay-colored, and many people experience intense itching without a visible rash. This itching can become widespread and uncomfortable, especially at night. What makes jaundice especially concerning is that it usually means the liver's ability to filter waste is already compromised. In liver cancer, this can happen when a tumor blocks bile ducts or damages healthy liver tissue, preventing bile from flowing normally. Unlike tiredness or digestive discomfort, jaundice is not caused by everyday lifestyle factors. It's a strong signal that something is wrong with liver function and needs immediate medical attention. Jaundice doesn't always mean cancer, but it always means the liver needs to be evaluated. Recognizing this symptom early can help identify serious liver conditions before further damage occurs. Number 6. Swelling in the abdomen, also known as ascites. Ascites happens when fluid builds up inside the abdominal cavity. In liver cancer, this occurs because the liver can no longer regulate blood pressure and fluid balance properly. As liver function declines, pressure increases in the blood vessels around the liver, forcing fluid to leak into the abdomen. At first, the swelling may feel subtle. You might notice your stomach looking slightly larger, your clothes feeling tighter around the waist, or a sense of fullness even without eating much. Many people assume it's weight gain, bloating, or digestive issues. As fluid continues to collect, the abdomen becomes visibly swollen and firm. The skin may feel tight or stretched, and movement can become uncomfortable. Some people experience shortness of breath because the swelling pushes upward against the lungs, making it harder to breathe deeply. Ascites is not just a cosmetic change. It often signals that the liver is under significant stress, and that blood flow through the liver is being blocked or disrupted by the tumor. This fluid buildup can also increase the risk of infections and discomfort if left untreated. What makes ascites especially concerning is that it doesn't resolve on its own. Diet changes or exercise won't reduce this type of swelling because the cause is internal and related to liver function. Swelling of the abdomen is a serious warning sign. While it doesn't always mean liver cancer, it always requires medical evaluation, especially when it appears alongside persistent itching, jaundice, or leg swelling. Early recognition can help prevent complications and guide proper treatment. Number 7. Changes in bowel habits. The liver plays a key role in digestion by producing bile, which helps break down fats and move waste through the intestines. When liver cancer disrupts this process, digestion becomes inefficient, and bowel movements can start to change in noticeable ways. One of the most common changes is a difference in stool color and consistency. Stools may become pale, light-colored, or clay-like because bile is no longer reaching the intestines properly. Some people also notice stools becoming greasy or difficult to flush, which happens when fats are not being absorbed as they should be. Bowel habits may also become irregular. You might experience ongoing constipation, diarrhea, or an unusual pattern where bowel movements no longer feel predictable. These changes often develop gradually, making them easy to overlook or blame on diet, stress, or aging. What makes this symptom important is that it reflects a deeper digestive imbalance. When bile flow is reduced or blocked, waste products and toxins aren't processed correctly, affecting the entire digestive system. Over time, this can lead to discomfort, bloating, and nutritional deficiencies. Many people dismiss bowel changes as minor digestive issues, but when these changes are persistent, unexplained, or appear alongside other liver-related symptoms, they become a sign that liver function may be compromised. Changes in bowel habits don't always point to liver cancer, but they do indicate that digestion is not working normally. Recognizing these patterns early can help identify liver problems before they progress further. Number 8. Enlarged liver. In liver cancer, abnormal cell growth can cause the liver to increase in size. As the tumor grows, it stretches the liver tissue and pushes it downward, making the organ easier to feel below the rib cage. This symptom is usually discovered accidentally. Some people notice a hard or uncomfortable area when lying down, bending forward, or pressing gently on the right upper abdomen. Others feel a sense of pressure or fullness rather than pain, especially after meals or when sitting for long periods. An enlarged liver doesn't always cause sharp pain. Instead, it may create a dull ache, tightness, or a heavy feeling under the ribs. Because this discomfort is often mild at first, people assume it's muscle strain, posture-related pain, or digestive discomfort. What makes this sign important is that a healthy liver is normally soft and not easily felt. When the liver becomes firm or enlarged enough to be noticeable, it often means the tissue structure has changed. In liver cancer, this can happen due to tumor growth, inflammation, or blocked blood flow within the liver. Feeling a mass under the right ribs is never normal. While it doesn't always mean cancer, it always requires medical evaluation to understand why the liver has enlarged. Early detection of liver enlargement can help identify serious liver conditions before they cause permanent damage or spread further. Number 9. High temperature and excessive sweating. In liver cancer, the body can develop ongoing low-grade fevers or sudden spikes in temperature without an obvious infection. This happens because cancer can trigger an inflammatory response, confusing the immune system and causing it to behave as if it's fighting a constant threat. Many people notice they feel unusually warm, feverish, or flushed, especially in the evening or at night. Night sweats are common, where a person wakes up drenched in sweat even in a cool room. These episodes can occur repeatedly and may worsen over time. Unlike fevers caused by infections, this type of temperature change doesn't always respond well to basic medicines. The fever may come and go, making it easy to dismiss as stress, exhaustion, or a mild viral illness. Excessive sweating can also occur during the day. Simple activities like walking short distances or resting may trigger heavy sweating, leaving the body feeling drained and weak. This symptom is important because it often signals that something deeper is happening inside the body. In liver cancer, toxins and inflammatory chemicals may circulate in the bloodstream, affecting temperature regulation and energy levels. If fever and sweating persist without a clear cause, especially when combined with other liver-related symptoms, it's a strong sign that medical evaluation is necessary. Ignoring repeated unexplained fevers can delay diagnosis, allowing the condition to progress silently. Number 10. Unexplained weight loss. Losing weight without trying may seem harmless at first, but in liver cancer, it's a serious warning sign. Tumors in the liver can interfere with the body's ability to process nutrients and store energy. Even if you're eating normally, your body may not absorb food properly, causing gradual weight loss over time. At first, it may be just a few pounds slipping away, or clothes feeling slightly looser. Many people ignore it or blame stress, diet changes, or increased activity. But unintended weight loss from liver cancer has a hidden cause. It happens because the liver is struggling silently, breaking down fat and muscle to fuel the body when nutrients aren't being processed correctly. What makes this symptom dangerous is how subtle it can be in the beginning. You might not notice the loss right away, or it might appear slowly over weeks or months, making it easy to dismiss. But even modest, unexplained weight loss is a signal that the liver is under stress and the body is not functioning normally. As the condition progresses, the weight loss can accelerate. Muscle mass decreases, strength fades, and overall energy drops. Unexplained weight loss is never normal. It doesn't matter if you eat enough, exercise, or feel otherwise healthy. Your body should maintain a relatively stable weight unless there is a clear reason. Early detection matters because identifying the cause of unexplained weight loss can lead to earlier diagnosis. Addressing the underlying problem early can help preserve strength, improve treatment response, and prevent further decline. Number 11. Enlarged spleen, felt as a mass under the left ribs. In liver cancer, normal blood flow through the liver can become blocked. This causes pressure to build up in the veins that carry blood from the digestive organs, including the spleen. As this pressure increases, blood begins to back up into the spleen. Over time, the spleen becomes swollen and enlarged as it works harder to filter blood and remove damaged blood cells. Many people don't recognize this symptom at first. They may think the discomfort or fullness on the left side is caused by gas, overeating, muscle strain, or poor posture. Some people don't feel pain at all, just a constant heaviness. As the spleen continues to enlarge, it can press against nearby organs. This may lead to early fullness while eating, discomfort when bending forward, or a dull ache that slowly worsens over time. An enlarged spleen is dangerous because it signals serious internal pressure and circulation problems. It can lead to low blood cell counts, increased risk of bleeding, infections, and in severe cases, spleen rupture. Early detection matters because this symptom reflects advanced stress on both the liver and the blood system. Recognizing it early allows doctors to manage complications, reduce risks, and investigate the underlying cause before irreversible damage occurs. Number 12. Nausea and vomiting. Feeling nauseous or vomiting without an obvious cause can be an early sign that the liver is under stress. In liver cancer, the liver struggles to process toxins, nutrients, and waste products efficiently. When these substances build up in the bloodstream, they can trigger the brain's vomiting center, causing repeated nausea or sudden bouts of vomiting. This doesn't always appear severe at first. Sometimes it starts as a mild, queasy feeling after meals or a sense of discomfort in the upper abdomen. Many people dismiss it as overeating, food poisoning, or a mild stomach bug. But in liver cancer, this nausea occurs even when eating small amounts or when the stomach is otherwise empty. What makes this symptom dangerous is its subtlety. You might feel fine one moment, then suddenly experience a wave of nausea or retch once or twice a day. Because it comes and goes, people often ignore it, thinking it's temporary, but it reflects an underlying problem with liver function. As the condition progresses, nausea and vomiting may become more frequent or intense. Some people notice that certain foods trigger it more than others, or that vomiting happens first thing in the morning. Over time, this leads to reduced appetite, dehydration, and further weight loss, weakening the body and making it harder to tolerate treatment. Persistent nausea and vomiting is never normal. It doesn't matter if you eat healthily or have no stomach issues in the past. When these symptoms appear repeatedly without a clear reason, they signal that the liver may not be working properly. Number 13. Persistent fatigue and weakness. Feeling constantly tired or weak, even after rest, can be one of the earliest signs that the liver is under stress. In liver cancer, the liver's ability to process nutrients, store energy, and filter toxins is reduced. As a result, the body struggles to get the energy it needs, leaving you feeling drained throughout the day. This doesn't always look dramatic. You might notice it as a slight decrease in stamina, struggling with tasks that were easy before, or a constant heaviness in your limbs. Many people dismiss it as stress, a busy schedule, or lack of sleep, but in liver cancer, this fatigue is persistent and doesn't improve with rest. What makes this symptom dangerous is how subtle it can be initially. You might feel a little off for weeks or months, thinking it's temporary, but your body is actually signaling that vital liver functions are compromised. Over time, the fatigue can worsen, affecting your daily activities and quality of life. Simple activities like climbing stairs, carrying groceries, or even walking short distances can feel exhausting. The lack of energy often comes with other subtle signs like loss of appetite, mild nausea, or pale skin, clues that the liver is struggling silently. It doesn't matter if you exercise regularly, eat well, or sleep enough. When your body constantly feels drained, it is sending a clear signal that something serious, such as liver cancer, may be developing. If you noticed any of the symptoms we discussed today, even if they seem mild or come and go, please don't ignore them. Liver cancer often stays silent until it becomes serious, and early detection can make a life-saving difference. Your body speaks in signals: jaundice, swelling in the abdomen, dark urine, changes in your bowel habits, unexpected weight loss, unusual fatigue. These are not things to overlook. You deserve answers, and you deserve peace of mind. So if something doesn't feel right, talk to a healthcare professional. A simple checkup, a scan, or even a basic examination can give clarity and potentially catch a problem before it becomes dangerous. Remember, awareness is the first step, action is the second, and your health is worth both. If you found this video helpful, share it with someone you care about. You never know who might need this information today. Take care of yourself, listen to your body.